kidney dialysis. So, yaba no, ene ampa, ngofo bebre nya kidney problems. Enti umu hiya dialysis. Dialysis no so, sikano doso. Nipa bebre intimi entuya sa sikano. Enti 6 months ago, ye started pilot. Say the dialysis no beba National Health Insurance. So nipa na umuye over 60, any under 18 for the last 6 months. Umuji dialysis under National Health Insurance free. The pilot no eba every from December 1st this year. From December 1st, all kidney dialysis patients umubeji under National Health Insurance free.
Expounding on the initiative, NHIS Chief Executive Officer Dr. Da Costa Boaje explained that more dialysis machines are being procured to support the policy and facilitate kidney transplants.
Once we know the real cost, there could be public sensitization for us to know how we're going to address it. We just have to exercise patience. We have to work with the teaching hospitals to make sure that the money is actually going to people who actually need. We know that the money is inadequate. Like I said, it's just an initial emergency fund to support people going through dialysis, especially the needy, whilst we await the committee's report on the actual cost and its impact on our funding, so that we can now lay it bare to Parliament.
Additionally, he highlighted the role of free medical checkups and wellness clinics in alleviating the growing burden of chronic illnesses such as chronic renal failure and other non-communicable diseases by promoting prevention. The NHIS is also actively encouraging healthy lifestyles as well as early detection and treatment of hypertension and diabetes, which are primary causes of chronic renal disease. Furthermore, the government is working to enact a law governing tissue and organ donation, storage and transplantation to support kidney and organ organ transplants in the country. The policy is complete and currently undergoing stakeholder consultations in preparation for cabinet and parliamentary approval, with the aim of passing the law in the next session of Parliament. In March 2024, shortly after GHOne TV aired Evelyn Araba Edu's report, Dialysis Dilemma, the Presidential Advisor on Health, Dr. Anthony Nsiasari, assured the public that the government is prioritizing legislation on organ and tissue donation by the close of Parliament this year. This move, alongside a natural analysis to include dialysis under the NHIS, aims to support kidney transplants nationwide.
The high cost of dialysis has led to the premature death of many people who could not afford it. 2. High cost of kidney transplant and legislature, which I've mentioned already. Although kidney transplantation is preferred treatment, it is costly and out of the reach of most of patients. Regardless, it is critical to enact laws to make kidney treatment more accessible to individuals.
On 1st June 2024, government announced a free 6 months dialysis support program for renal patients from June to December 2024. This is to support high-risk populations of renal patients under the age of 18 years and those over 60 years by offering 8 free dialysis sessions monthly while absorbing 2 sessions of those between the ages of 18 to 59 years.
So it's a welcoming news. We thank God at long last this thing has come to materialize. We bless, we thank them. It has taken some time, but now that it's here, we thank them and we really appreciate it. We knew, some of us knew something was in the pipeline. We're just waiting for the announcement to be made. I can say for the children below 18 and then the aged, they are looking more healthier because they are getting their regular session. We in the middle from 19 to 59, we were suffering because we keep losing casualties. People keep passing away because of they were not having chances to do the regular dialysis that they have. So far so good. I mean, I would say now this is coming up, but we hope we will be a bit more comfortable with what we are hearing. Since a committee was set up and this was planned, we sat down, we discussed, and we forwarded a report to them. Only just for me, I was a bit disappointed because it had taken that long, because we needed it so that people would sustain. So I'm believing maybe they took it to the board, they look into whatever we discussed and we send it to them, and they realized that what we were saying is something they could have done. So I'm not surprised they are now bringing it up. Like again, I hope it's not a political agenda. I hope and I pray it's not a political agenda, because we've sat down, we've discussed, and we send them a report, knowing that if only they will stop capping the national health insurance, it can take care of all of us, not even kidney patients alone. There are other places that will also need those things. So I hope it's not a political agenda, and I believe that he's a vice president of the republic. He shouldn't let it be one of those things. We are begging them.
I was very excited that now health insurance is going to take it. Is it from this month or is it next month? December 1. We will be coming for dialysis free. I was very excited because they said the consumables are very costly. So if they are very costly and health insurance is going to take it, I fear today they will say there are no consumables. Tomorrow is off. Today is off. Tomorrow is on. That is my fear about the health insurance. If only they say it's free and government brings the consumables every time, then I'm okay. But I'm afraid now that is going to be free, you know.
The moment I heard this, I was really happy because it's not easy for me to get money coming from dialysis.
Evelyn Araba Edu, reporting for GHOne News.